This video is made to reinforce the written and in-person instructions provided to you by your Providence Infusion RN during your teaching visit. The Mini Bag Plus system is used to administer IV antibiotics that are stored in a powdered form and must be reconstituted and diluted into the fluid reservoir of the mini bag prior to installation. First, you'll need to wash your hands and prepare your workspace. Line it with paper towels. Gather your supplies, including the mini bag, which contains the diluent in which the medication will be dissolved, the glass vial that contains the medication, and the alcohol pad. The mini bag has two ports. The wide port has a bell-shaped blue plastic drug vial adapter with a foil cover over the end. The narrow administration port is where you'll be inserting the IV tubing. Take the vial that contains the medication into one hand and remove the plastic cap with the other. This will expose a rubber stopper in the center and top of the vial. Clean the rubber stopper with an alcohol pad for 15 seconds, taking care not to touch the clean rubber stopper. Peel the foil cover off of the blue adapter of the mini bag. Inspect the inside of the adapter for any visible moisture. Discard the bag and get another if any moisture is noted. Hold the medication vial securely on a flat surface with your non-dominant hand. With your dominant hand, grasp the blue adapter of the mini bag and firmly press the adapter onto the top of the medication vial until you hear and feel an audible click. Grasp the adapter firmly with one hand, pull gently on the medication vial with the other to confirm that the medication vial is securely connected to it. Using both hands on the stem between the adapter and the mini bag, bend them up and down repeatedly to break the seal. Once the seal is broken, hold the bag upright with the vial on the bottom and squeeze the bag of diluent fluid until the vial is filled halfway with diluent fluid. Gently swirl the vial to mix the drug into the fluid. Now hold the bag upside down with the vial on top. Squeeze the bag to force air into the vial. Alternately squeeze and let go of the bag so the medication drains back into the bag. Make sure the drug is fully dissolved. Do not remove the drug vial. Remove the protective cover from the administration port and push the spike of the tubing into the port of the medication bag. Twist and push the spike until it's completely into the port. Make sure your fingers do not touch the spike or the port as it enters the medication bag. Hang bag on the IV pole and attach to the pump and prime the tubing as directed in the individual specific directions given to you by the nurse who gave you the training. You are now ready to watch the videos which will review attaching, loading, and priming the tubing. If you have any question regarding this procedure, please don't hesitate to call Providence Infusion for further instructions.